Excellent evening, everyone. Excellent evening to every one of us. We're all highly welcome to this evening's broadcast. Welcome, welcome, welcome. How are we? I hope we're all doing great. Right, we are all welcome to this evening's broadcast. As we all know, today it's a special day. Today we're going to be looking at menopause pains generally. Menopause muscle pains, okay? Generally, and all pains, and then we also try to differentiate it for you, what menopausal pains are and how they are also different from other pains that you might be experiencing that are not really menopausal pain, because you actually need to know what you're going through to be able to know how to handle what you're going through. I feel a little dry. Dryness on my lips. Let me put my aloe lip. I hope you're right here. Welcome, welcome. If you join me live, you can greet. I can welcome you to this evening's broadcast. Welcome, welcome to every one of us. So who is online with me, you can greet. I can welcome you. Welcome, welcome, welcome to this evening's broadcast. I feel dry on my lips because I'm doing a kind of program which I'm going to be sharing with us later. Okay, after all my holiday junking, trying to eat right and junking at the same time, I have to do my program once I land my home. That's me for you. Okay, so you're highly welcome to this evening's broadcast. Welcome, thank you for joining me. For those of us who have joined, you can greet. So I can greet and welcome you to this evening's broadcast as we look at menopausal muscle aches, menopausal pains. What are they? How are they different from any other pain you might be having? How are they different? That's what we're going to be looking at today. So we'll spend time to actually tell us what and what it is. So if you've joined me live, you can greet. I hope my phone will behave itself today. I don't want this network. See my phone for me. Who is online? You can greet. Hello, IK, you're welcome. Welcome to this evening's broadcast. Welcome, welcome to you. I want to share. So let's share, let's share out, let's share out. Let's share out to friends so that we can get going today. If you've joined me live, you can as well help me to share out to friends. I want to share this out. And if you're live, you can also greet. So I can see you and welcome you to this evening. Sarah, you're welcome. So finally you were able to join. Sarah was so concerned. She said she's not been getting notifications. So what you do, if you're on the page, okay, right now you can as well put share or notification. Click on like, click on follow so that you'll be getting notifications, okay? Just click something on the page, make a comment on the page so that you'll be able to be getting notification. If you're quiet and you don't click, you don't follow, you don't like, you might not get notification, because sometimes also you get lost. Facebook will change a few things and then you're not able to see me live. So when you come in at any time, you're able to just click on follow or click on like, so that you will be able to get those notifications back again. A lot of people complain about this, so I need to actually explain it to us. Okay, so please share. Who is sharing with me? Let's share, because this video is absolutely important for every middle-aged woman. It's absolutely important for us. And I'm back home. You can see my background. It's so good to be home. Being away for nearly 5 weeks. Oh my goodness. One of the longest holidays in recent times. One of the longest holidays in recent times. So I really am glad to be home. I'm so glad to be home. Hey. So thank you all for joining me. Welcome those who are joining us for the first time today, and then we get going Hello, Titilola Ajayi, you're welcome. Welcome to this evening's broadcast. Josephine, you're welcome. Welcome, Grace. Welcome, Adora. Ugu. Welcome, Sarah. Sarah, thank God that you joined us today. So please, let's just share. Welcome, Joy Vincent. There are a few people that must have joined earlier that I didn't see. Well, my laptop is refusing to go out of my other network and follow my phone, so let me leave it, and at the end I'll see what I will do about it. So we are all highly welcome. I am back home, so I am so glad. After a wonderful holiday, I took time to rest, to pray, to think, to evaluate, to reorganize my life. And you know, that's the good thing about holiday. I hope we just don't take holiday to jive. Okay, let me see. I think I just took like 2 or 3 days shopping out of the 5 weeks, okay? And I got some healthy food stuffs that I can't get around or that are very expensive because of their weight. In fact, I even paid excess luggage to carry my almond flour, my oils. I got coconut cold press oil, organic. I also got avocado oil. It's so exciting. You're going to be seeing it next week. Oh, I'm not around next week Wednesday. Anyway, we'll still do some kind of cooking in any kitchen I find myself. But I'm going to be showing you, maybe on Saturday, I will show you all the things I bought. Healthy foods. Okay, when I travel for myself. I travel for my health. I travel to look good. Like I tell people, I have enough clothes in 20 years. So shopping for clothes is not really, if I'm shopping for clothes is functional. So I shop to make sure my body is okay, my health is okay, I'm feeling good at this age. What else now? If you look at what Solomon said, you'll find out what you do for yourself, okay? Love your job, love your spouse, okay? And make sure you eat and enjoy yourself and eat well. Hello, Ruth Philip, you're welcome. Esther Effiong, you're welcome. Adams Laba, you're welcome. John Vincent, you're welcome. Okay, right, today we are looking at menopause aches, muscle aches, pains, and other pains, okay, that come with menopause. Some of those symptoms. And remember, I have a book on 34 symptoms of menopause. If you don't understand what is happening to your body, you need that book. You need that 34 symptoms of menopause book. I call it the Healthier, Happier Menopause, okay? It teaches you on remedies, some of the symptoms and what you can do about them, the broad, view of it. So you need the book. And today again, because I'm dealing with menopause, it's going on 50% discount for my menopausal book. Usually it's 2,000 naira, but today you can buy it at 1,000. Just chat me on my WhatsApp number +234 703 515 1642. I'm going to put my WhatsApp number, okay? My WhatsApp number is +234 703 515 1642. +234 703 515 1642. It's so good to be home. I'm just so excited. Back to base. It's so good. Hey, I'm back to base. I hope this on my laptop is not here. I hope this thing will let me pin this. All right, anyway, so what is menopause? Okay, menopause is a natural part of the aging process. Remember, this is anti-aging page. It's aging with grace. It's rejuvenation page. We know nature puts it that we will age. We all know we will age. If we are aging as you're adding to your years, so many things are adding. So menopause is just a natural aging process, okay? And like if you go down my page, you will see a lot of videos I've done on menopause. Like the first stage of menopause is pre-menopause, when people are still having, okay, is pre-menopause. Perimenopause is now the actual first stage of menopause, and that it begins to affect a woman's ability to reproduce. Your menstrual cycle is reducing, your egg production and viability is reducing. Okay, perimenopause typically begins during the early to mid 40s, like from 40, and that's like early menopause. Those who have it before 40 years, we call it premature menopause, and those who have it like mid 40, that's the normal average time that menopause is supposed to come. And for some people it lasts 3 years, for some people 5 years, for some people it even extends up to 7 years. Okay, now the woman is considered to be in menopause when she has gone through 12 months without menstruating, without having her period. Okay, when you've gone 12 months without having your normal regular periods, After that 12 months, you're said to have entered menopause. And the average age for menopause, it's about 51 years average, okay? Some people have it 52, 53, 54, some even 47. And that is called also early or premature menopause. So perimenopause and menopause are triggered by hormones that fluctuate and decrease. They fluctuate and then they decrease, and the fluctuation sometimes, you know, they become erratic. They are more, they are less, they are normal, or but once you hit menopause, they start decreasing. So it's that fluctuation that makes people who are in their perimenopause today they are good. They'll say, oh, these symptoms have stopped, I'm okay. And then after like 6 months, 1 year, they are beginning to feel the symptoms again, because their hormones have already also, you know, gone haywire again. So many parts of your body are affected as your hormones decline. Many parts of your body are affected. Hello, Ngozi, you're welcome. Welcome for Ramade, good evening. Let it not fear you. There are very good parts of menopause. Maybe I will repeat that session again. I have a video on the good part of menopause. Okay, let me give you one good part of menopause. You can feel free and enjoy your life with your husband, sex, okay? Not being afraid of pregnancy. That's what we are enjoying now. You're not afraid of pregnancy. So that's it. That's what. And another part of good part of post-menopausal season is that sometimes there are some of these diseases like hot flushes. For some people it stops, some of those symptoms stop. So there are good parts of menopause, okay? All right, but then many parts of your body are affected as the hormone decline during perimenopause and menopause, and these are like your reproductive system. Your eggs are no more viable, you don't see your periods again, you have issues with your vagina, your uterus and things like that. Your vaginal tract, nervous system is affected because of the low and fluctuating production of estrogen. So, and then your heart, your brain, your bones, your skin, all these are common symptoms that are often associated with hormonal changes in women. It can actually be very, very, you know, erratic and very, very serious. Hello, Neke is there. You're welcome. Oluchi Teresa, you're welcome. Deborah, you're welcome. All right, welcome, Neka Lydia. And also yesterday, text for me. I'm facing something like that. My neck, my pain. I'm telling you, that's the period you can wake up this morning. Your neck will just refuse to move. Sometimes you wake up, your whole system is filled with gas. All these are fluctuations of estrogen. It can be terrible, but the good thing is that it's a natural process, and if you handle it well, you will live well in it. When I discovered what could help me, I don't complain about menopause again. I'm out and up above it. But I tell you the truth there, maybe like 7 years ago, it was very serious. There was a time I used to visit the hospital almost every two weeks. Because, in fact, what did I even say? There was a time when this thing started, perimenopause issue started, and I was bleeding for like 6 months continuously, non-stop. And bleeding will be small bleeding, though. It will just be rushing like this. Sometimes I'll just decide to sit at home. Sometimes I will have like 1 pack of tampon that is 32 pieces. It will finish in maybe like 4 days. So it can be really, really horrible, okay? I remember my doctor, my gynae that time, I used to go to take one injection that was like 45,000 naira then when I started it. And then I'll pay consultancy fee because it's every month, 5,000 naira. And then because I have to stay in half day in the hospital for them to watch me after the injection, another 10,000. This was like 7 years ago. So I did 15 plus 45. How much is that one? 60,000 down. If I now come and in those days maybe all size, yeah, sugar level and all that, you know, money will be increasing. It was like hell. But thank God for the natural things I discovered, you know. And I tell people there are 4 things. If you're a middle-aged woman, don't joke with it. Don't joke with your diet. And that's why when I traveled to US, all the states I went to, if I went to any shop, I went to organic shop, I went to bio shops, I went to all those places to get things that I need, because I know naturally when I come home, I have my vegetables, okay? The second thing is exercise. Don't joke with your exercises. Even when I traveled, I took my walks. I walked around the streets, I went shopping just to walk about, even if I'm not buying anything, just to walk about and have my walk. The third thing is supplementation. A lot of people are deceiving ourselves. You can get a lace of 150,000, you pay cash down. Get your Italian shoes, 150,000, 70,000, 35,000, pay for it, you're feeling good about it. Now, you're servicing everything excepting this, your body that God has given you. This your body that is even helping you to make the money, you know, for all that. And this your body that you need to stay longer to take care of your children and everyone you will live with. No, that's not for me, for you. I take care of my body. I make sure I do what I'm supposed to do. And the last thing, you know, it's lifestyle changes. There are so many things we need to change about our lives. All right. Anyway, today we're looking at muscle cramps, pains, body aches that come with menopause. Okay. Your menstrual cycle is regulated by luteinizing hormone and follicle stimulating hormone. These two hormones, okay? These two hormones are manufactured in the pituitary gland, and they stimulate your ovaries to produce estrogen and progesterone. Okay, these two hormones. Okay, all right. Now, during perimenopause and menopause, these hormones fluctuate, and they can cause some painful symptoms. Okay, they can actually cause some painful symptoms for you, and we're going to be looking at some of the symptoms they cause for you. They will cause if you have these fluctuating hormones very, very soon. But first of all, let me, you know, tell us what are the causes of these aches and pains before I tell you what the aches and pains are. Now, if you start to get aches and pains during menopause, estrogen is likely to play an important role in it. Your estrogen is likely to be what is playing an important role in it. Hello, Father Kemi, you're welcome. Welcome, Adeshola. Welcome, Esther Samuel. Welcome, Titilayo Ajayi. You want the book? Okay, chat me on my WhatsApp number, +234 703 515 1642. I don't know why my laptop doesn't want to come up with my network, so I can pin that number. But I'll keep calling my number because of that. All right, +234 703 515 1642, so you can get the book. That book is very, very important. Only today is going on half price, 1,000 naira. Usually 2,000 naira. I sell it, and I also have other books. Like we just launched my my book on recipes, 28 solid recipes that will help you during this menopausal season. All right, so chat me on my WhatsApp number, Salam Maria Evon. Also, Gold, how are you? Esther Ekam, Sue, how are you? Omo, Owomo, hey, Ada, you're welcome. Oh, from New Jersey. Hello, you're welcome. Welcome from New Jersey. Ojitaji, you're welcome. Patricia, you're welcome. Omole Florence, you're welcome. So I'm saying, if you start to, you know, experience aches and pains during menopause, estrogen is one of the major issues. There could be other issues which I'm going to be sharing with you very, very briefly now. Okay, so estrogen affects your cartilage, which is the connective tissue in your joints, okay? And then as well as the replacement of bone. When you're losing estrogen, when your estrogen level is reducing, that's why people at older age, they seem to have bristle bones, okay? Because they are, it also affects the replacement of their bones, okay? And also it plays a major part in inflammation and pain. So replacing your estrogen has been shown to benefit you. You must find how to aid the reduction of the estrogen, okay? Using cytoestrogen food, supplementation, exercises, and things like that. I'm going to be sharing some of them with you. So that said, the cause of your muscle aches may be unrelated to menopause, like I told you. For example, poor posture, particularly sitting in the same place and in the same position, looking at a screen, like those of us who work long hours in our offices, on computers, watching television for long hours. They are also culprits to pains that you might have at this age. And that's why I suggest, please, if you don't have fitness ball, buy fitness ball. Okay, I couldn't buy the crane of my fitness ball now because I had excess luggage. I'm going to buy it and I'll cargo it. That's what I'll do to the crane of my fitness ball. And if it's okay, Then some people might be buying the crane, but you can just buy the ball. I use the ball. I dashed my ball to one of my 100 global influencers because I passed through Ghana, Kate. So I gave her my ball. I've not blown another one since I came because I just came back on Sunday. The one that I use is the one for my musicians that I keep for them to sit when they're sitting for long. I just put it in the studio for them. All right, my husband's musicians. All right, so you need fitness ball. Fitness ball will help you to reduce the pain that comes from posture, and then you need to stand well, sit well when you're sitting in your office. If some of your chairs need cushion, put cushion in those chairs. And then stress can also be another culprit. Stress can also cause muscle tensions for you also. All right, so if you look at it generally, how many women typically experience muscle aches and pain? In fact, musculoskeletal pains is common in menopausal women, particularly joint pains, starting from your fingers, okay, your wrists, your elbows, your shoulder bone, joints, up onto even your ribs, your back, your waist, your knees, your ankle. Is very, very common in menopausal women. In fact, there's one study that was done. Joint aches were experienced by almost 40% of women aged between age 45 and 65. Between ages 45 to 65, 40% of the women. One common thing you will hear them talk about is my leg is aching me, my waist is paining me, my shoulder, my neck, my this one, okay? But there's one thing we need to do today, which I want to briefly go through before I'll tell you some of those pains you experience and what you can do about them. You need to differentiate between arthritis and menopause related muscle aches and pains, okay? They are not the same, and you need to be very, very careful about that. Hello, Ifi Carol, you're welcome. Ngozi Nwajako, you're welcome. Lizzie, you're welcome. Nwaneka, you're welcome. Adeyoma Adenike, you're welcome. Ifi Carol, you're welcome. Mary Stable, you're welcome. Maureen Aduba, how are you? I've answered your chat. So Maureen, check your chat, okay? Maureen is also one of my retaining customer. Thank you very much for buying from me, for listening, being my fan, and the rest. I remember I posted something on the 1st. In fact, I'm on a program for all my families, friends, fans. And when I talk about family, I have several families. I have my biological families, my immediate unit family. We had chats yesterday to pray together. I'm fasting. I'm taking 3 days fast, which we end tomorrow, okay, for you, because I want you to be in good health. God sees my heart. I prayed for all my fans, I prayed for all my followers, and I asked God to give you good health. Giving you good health will help me. Giving you good health will promote me, because then when you're buying my supplements, you're buying it not for management or for cure or for treatment. You are not buying it for prevention, because you need these supplements to stay on top of your health, to be optimal health. So that's why I prayed. I'm still in the program. I've not taken any food for the past 3 days. 4 days program actually. So on the 5th day I eat, because I'm praying for you. And I want you to say amen to all the prayers. Good health. And when I pray for you about good health, I understand health very well. So I pray for 8 dimensions of health. That's what I've been praying every day for you. Physical health, medical health, mental health, social health, financial health, occupational health, okay, social health, and otherwise, all of them. That's what I'm praying for you, and God will grant unto you in the name of Jesus. So if you're finding that your muscles often ache or feel sore, it could be another symptom of menopause, okay? Telling the difference between the muscle pain in the menopause and the aches and pains from arthritis can be very tricky. Now, of course, having the aches doesn't mean you have arthritis. Some of the pains you're having is not just a matter of arthritis. Let me give you an example. When I started my fasting program, okay, or the program I'm having, the challenge I'm having, I'm praying and tarrying for you, I found out that gas, anytime I drink water, gas will accumulate on this part of my body. And when that gas accumulates on this part of my body, I'll begin to have pain. In fact, yesterday I woke up, I couldn't turn my neck, I couldn't raise my neck. What was happening to me was detoxification, because my body was going through detox, okay? It was not detoxifying those areas, and it brought that stiffness sort of. Today I'm very okay. All right, it's not arthritis. Some people would have raised the alarm, start rushing from one hospital to the other, that is arthritis. So of course, having aches and pain doesn't mean you have arthritis, but it's very, very important to know when to ask for help and when to ask for advice. During the menopause, women are more likely to get osteoarthritis, particularly in the hands, and also rheumatoid arthritis. Why? This is because osteoarthritis is caused by wear and tear of the joints, and rheumatoid arthritis is also an autoimmune disease. And when you're not producing enough estrogen, it can begin to cause all those, harassment in your body's antibodies will not be able to recognize what to fight and what to leave off. And then it will now lead to autoimmune problems. So this means your immune system, if you're having rheumatoid arthritis, which will usually fight infection, will mistakenly now attack the cells that line your joints, making your joints swollen, stiff, and painful. So if you have either of these conditions, you will need to see a doctor to go for your test, and then you can chat me later. We'll be able to talk. Some conditions that could also cause muscle aches specifically are fibromyalgia, okay? Especially if the aches and pains last longer than 3 months. If your fibromyalgia pains last more than 3 months, it will begin to cause aches and pain for you. And then also chronic fatigue syndrome, when you have overworked emotionally, thoughts, anxious, and all that, and physically, if you're chronically fatigued, it could cause pains. Also, myophysical pain syndrome can also cause pains and aches. And again, you know that infections like flu, polio, bacterial infections can actually cause some aches in your muscles, okay? Because it brings forth inflammation. So I'm trying to tell you that it's not always menopausal pain. It's not always menopausal aches, okay? But being in the middle age could cause some of these things, and then it will begin to look as if it's menopausal pain. Autoimmune disorders like lupus, dermatomyositis, and also polymyositis can also cause pains for you. So, and again, you know that the use of certain drugs we use at this age can also bring some of these aches and pains for you. Like those who are taking medicines to reduce their bad cholesterol. If you're on statins, it could cause pains for you, okay? If you're taking atorvastatin and all these drugs that are for reducing cholesterol, they can cause aches and pains for you. And that's why I always advise people, no, stay on your medicine, but make sure you take your antioxidants every day. I don't joke with my aloe vera gel. No matter the drugs you're taking, if you take aloe vera gel, it will detoxify you. It will remove the side effects of those medicine. That's the good thing about aloe vera. I drink this like water. I drink it every day. I take my aloe vera gel because it helps to remove free radicals. It helps to cushion the side effects of medicines and drugs that you're taking. Okay, hello Adobe Rose, you're welcome. Patricia Onyechi, you're welcome. Welcome Adiola, welcome IK. All right, amen, 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 Victoria, amen, Stella. All right, so also low potassium. If you're suffering from hypokalemia, which is low potassium, okay? If you have low potassium, it can also cause aches and pains in your joints, okay, for you. In fact, the list is not exhaustive, but just anytime you begin to feel any pain that is lasting for long, you need to do something about that pain, okay? You need to do something about that pain. All right, so like I said, in recent studies, they found that some women who had some kind of pains and aches in their bodies, that is about 40%. So during this perimenopause and menopause, these hormone fluctuations can cause the following painful symptoms for you. Some of the symptoms that menopause induce pains. So what are these aches and pains? The menopause induced aches and pain. Good evening, Odutola. Good evening, MMPs. You're welcome to this evening broadcast. Welcome, Chidinma Igbo. Welcome, Ado Oba. You're welcome. Welcome, Chioma. Welcome. All right, we're all highly welcome. So the first pain I want to talk about today is cramps and breast soreness. That one definitely is menopausal pain, okay? When you have, well, let me not say definitely, but most times when you're having cramps and breast soreness is menopausal. Why? Because the changes you have in your period, your menstrual period, may be accompanied by cramping at this period, because most times that your period is coming, it comes thick, it's not regular, the estrogen is not being produced very well, and then again it's more painful and intense than it used to be. So you may also experience increased breast tenderness, as if it's sore. Sometimes it will be doing as if it's itching and painful at the same time. Sometimes it's really very painful, especially before and just after your menstruation time. Even if you're not having that period, even if it's not coming out, when that season comes, it begins to happen. And then you may also find out that your menstrual flow is light. Sometimes you're just spotting, and some months you're very heavy, like I told you that happened to me. So what do you do? Like I said, the 4 things everyone should write it down and keep it, and make sure you practice and you do these things every day. Your diet, okay? You need to eat food that will give you cytostrogen, and those are dark leafy vegetables, colored vegetables, really deep colored vegetables, okay? And then also you also need to exercise, especially in the morning, to get that vitamin D and things like that. And then also you also need some supplement, like if you're having breast tenderness and you're having chronic you're having some menstrual pain, forever pomecin is very good. It's something that can help you. Pomecin is one of the supplements that can help you if you're having breast tenderness. Also, multi-maca is very impactful for you. Multi-maca, very good for you. And then of course your vitalized women. So if you're having breast tenderness, these 3 is what will help you if you're having breast tenderness. All right, so another one is migraine and headache. Okay, migraine and headache, maybe from insomnia as a secondary disease coming from insomnia, or just on its own. Fluctuation in your estrogen are linked to migraine headaches, okay? And you may get migraines for the first time, or even see an increase in the severity and frequency during your perimenopause. Some women have the reverse reaction. That's why I'm saying sometimes, you know, these things are not really absolutely the same for everyone. And some people now begin to see a reduction in the migraine occurrence that they normally have when they enter menopause. So this may be because high levels of estrogen can trigger headaches, and diminishing levels can also cause a decrease in it. So if you're having migraine, please make sure you sleep well. Do everything to make sure you sleep well. And to sleep well, one of the things that will help you is your blossom tea. Aloe blossom tea, very important for you. And then your Forever Focus. Forever Focus is one supplement that is so fantastic that can help with migraines and headaches, okay? And then another thing that can help you is aloe heat. This aloe heat is super power, especially if you get back in the night and you want to sleep. Let me tell you what I do. In fact, my husband discovered it. I just told him one night, like 2 nights ago, or like 5 nights ago. I said, he was saying, he wasn't sleeping. I woke up and found out he was awake praying and he wanted to sleep. I said, just take your aloe heat, okay? Rub it. You know, there is a kind of nerves here. I said, I massaged it for him. I always massage it for myself. I hope I don't sleep off while having this. So just massage it here, okay? All those nerves here. When you're having headache, if you do what I'm doing, that headache will cool down and you will be okay. So I'll just give myself some massage quietly here, and then also on my forehead. I'll put it on my forehead, all around my forehead here, and massage my forehead all around like this, very well with the aloe heat. In 10 minutes, I'll sleep off. Even if I'm working in the office, I'll sleep off, and before I know it, I'm very okay. So if you're having migraine, this will help you. All right. Then another pain that we might begin to have is joint pain. This is generally, and I've described from wrist pain, from your knuckles, your elbow, your shoulder, your knee, your waist, your back, lower back, and things like that. Menopause can actually cause joint pains that can affect your knees, your shoulder, your neck, your elbow, your hands, your knuckles, all this. And again, all joint injuries may then begin to ache you. Maybe where you've had an injury when you were very young, that you were not even feeling pain after a while. Like it happened to my husband one time, a child, when he was very young. Our third son, when he was very young, he's very active. So he was going down the staircase, and he fell. We put something, a barricade. Though. I don't know how this boy opened this barricade, or maybe the house help went down and forgot to close it. This is how this boy started tumbling down. So when my housekeeper screamed, my husband just jumped to the staircase and sprained his leg. After a while, that thing left. But you know, lately, if he stays in the cold, I'm going to be talking about cold and joint pain maybe on Saturday. So make sure you watch me on Saturday, 9 a.m. I'm going to tell you how to avoid and what to do during cold season to avoid all those pains. So menopause can make those old injuries to begin to ache you again. At times it goes on, you may not even start to notice that you're feeling more aches and pains in those areas you know before, but when you're now older, you begin to feel them. And that's because the estrogen that helps to reduce inflammation is reduced in your system. So as the level declines, inflammation will now increase, causing discomfort and also menopausal arthritis. Remember, I've handled menopausal arthritis on this page also. So you can also go and check and learn about menopausal arthritis. So again, what do? Those 4 things: diet, exercise. Even though you're having pain, don't say, oh no, I'm not going to exercise. Make sure you're exercising. Like I said, anywhere you're having pain, take your aloe heat lotion, okay? Rub your aloe heat lotion and then begin to do your exercise. And again, our Forever Move and our Active HA. Our Forever Move and our Active HA is fantastic. These 3 will help you with any joint pain. And as I came back, I just asked myself, I'm relaxed, I'm happy. How do I help people? Anybody having aches and pains, joint aches and pains, I want to help you this month. Okay? I'm going to give you a super discount, especially only for those who are here with me and those who are on my WhatsApp. Usually, I do like 20%, 25%, but I want to give you a whooping 30% discount just today and tomorrow night, 24 hours from now. If you're buying this set, you're buying it at 24% discount, at 30% discount, I mean. Just between now and tomorrow night, 8 p.m. tomorrow night, I close that bonus for you, because that's the main thing I'm treating today. I've really sold a lot of this, and it has helped hundreds of people all over the world, and I mean, okay? In fact, my host, when he took this, he was like amazed. He said, wow, movement became easier for him, okay? So that's discount, but only for the arthritis pain and the muscle aches and pains, okay? All right, other pains are still at their 10-15% discount. All right, so the 4th pain that could come is bruising. The outside of your body is also affected by fluctuating and declining hormones. Let me clean up this aloe heat. It's making me want to go and relax now. It's very, very relaxing. My whole body is let me finish my broadcast before I begin to relax. All right, so bruising outside of your body are also affected, okay, by fluctuation and declining hormones. Low levels of estrogen can cause a decrease in skin's elasticity, and it also lessens your skin ability to retain water. Right? So when it decreases your skin ability to retain water, it can be very, very devastating. See what I have done? I put a whole bottle of, that's what I do now that I'm doing my program, a whole bottle of aloe vera gel, 1.5 liter of water, and then I'll just put maybe like very tiny small aloe vera inside it, and I drink it the whole day, because aloe vera will help to pass the water down to your system very, very well. Aloe vera, we call it the traveler or the transporter, because and that's why when we give you some of our supplements, we insist to take aloe vera gel, because it helps to transport those nutrients to your body very, very well. I don't need to take my water. All right, so your skin becomes thinner and painful bruises is often the result. And then again, because of motion issue, you can just begin to hit your legs here and there. So if at this age, you need to take care of your skin very, very specially, for it to be able to glow, for it to be able to become what is supposed to be for you. Okay, you're supposed to take care of your skin very well. So what do I use? I use my aloe jelly, my moisturizing lotion, my infinite feminine complex, and my absorbency, okay, for my skin. And of course my R3 factor, that one is especially just for my face. But for the skin generally, your moisturizing lotion, aloe jelly that will help you moisturize, and of course your absorbency, very, very important for you. It will help give you supple skin. It will help your skin to have, you know, be moisturized, especially for people who are having dry, scaly skin. Even if you're having oily skin, this will also help to moisturize and keep it. And then again, you need to massage. Throughout this my trip, I use aloe heat every day to massage my whole body to help give it this soothing relief that I'm even having right now. All right, another pain that will come, that might come, is fibromyalgia. Okay, for women diagnosed with fibromyalgia, menopause may bring heightened sensitivity to the pain. Okay, now fibromyalgia is a chronic pain condition that is often diagnosed for the first time when a woman is entering perimenopause or entering her menopause proper. Some symptoms of menopause like pain, fatigue, and vaginal dryness overlap with those associated also with fibromyalgia. So for this reason, it is not always easy to determine which issue is causing the symptoms. But again, the 4 things are the solution: food, supplementation, exercise, and lifestyle changes. And make sure you stay on cytoestrogen supplements and foods that can help you. Again, another pain that we women go through, which is really associated with menopause, that is a menopausal pain, is pain during intercourse. Pain when you're having sex. The pain can sometimes accompany sex when you're in your menopause, okay? And this can also, you know, make maintaining intimacy with your husband very, very challenging. But women can find ways to keep their sex lives pleasurable during perimenopause, during menopause, and during post-menopause. It's very, very possible. In fact, like I told you, that's one of the advantages, because you're not afraid of having children. So you need to work on your sex life to have that sexual enhancement that can help you enjoy sex. Now, when we were having babies, we are afraid, hey, we might get pregnant or something will happen. But now that it's during your menopause, it's the time for you to actually enjoy your husband, enjoy your sexual intercourse with your husband. But these menopausal symptoms and issues will come and hinder it, because your estrogen, that's the hormone which is in short supply during menopause, which helps to keep your vaginal tissues elastic, is reduced. So it's also, this menopause estrogen also supports the moisture production in your vagina, which helps to make sex comfortable. So as this estrogen declines and recedes, your vaginal tissue gets thinner. The tissue gets thinner, and this actually is the reason why your sexual intercourse is painful. And also the vagina becomes less lubricated and more prone to inflammation, more prone to dryness, more prone to tearing. So it now makes intercourse very, very, you know, painful for you. And then again, another thing that happens with menopause is vaginal atrophy. Okay, and this can also cause your vagina to shrink and shorten in length. And vaginal atrophy is often accompanied by urinary tract symptoms, such as urinary leakages. If you're having urinary leakages because of that reduction in your vagina, which is called vaginal atrophy. And then also it can also bring burning sensation when you're urinating, and also that urgency when you want to urinate, you will be feeling that urgency to urinate. These are all because of the changes in your hormonal level, okay? And it also will now cause a reduction in your sexual desire, lessen the ability for you to be stimulated and aroused. And this can even make it very, very harder again for your vagina to become lubricated. When you have sex less, you also, is a cycle, okay? It's a cycle. This problem will come up, and then your vagina is less lubricated. The less sex you have, the less lubrication you have. So that's why some women who have found themselves not having sex for like 1 month, 2 months, 3 months, 4 months, it's very, very difficult for them to have it. So frequency of intercourse is very, very important for you. And then again, You can also use the 4 things I talk about: supplementation, okay, exercises. I've taught you some Kegel exercises that can help you to have better sex life. I've taught you that. You can go down my page and learn that. And then again, super for you is our aloe jelly. It's one fantastic lubricant that should be beside your bed. And this lubricant is not just used only during sex. You can use it after having your bath. It's I don't know if this is my own or the new one. Okay, it's the new one. My own is beside my bed. I didn't pick it up. It's it helps with lubrication, okay? So after having your bath, you will open it. I'll open this one because I use this frequently. Also, it's for me, it's a multi-purpose. I use it on my hair, like when I treated my hair this week. Okay, it's even here. When I say when I treated my hair, remember? So it's even here now. That's the one I just opened, okay? It's the good thing when you're using lubricant, let me sound this one. Please don't use oil lubricants. Water soluble lubricants are better, like what I have here. Can you see? It's water soluble. So if you put it on your vagina in the morning after having your bath, it's not going to stain your pants, it's not going to stain anything. Just before having intercourse with your husband, you can also take it and just put it, okay? Once you finish and you use water and wash off, everything goes. You don't even need to wash it off. It's very good. It will help you if you use it after bath, and then you also use it during your intercourse. And again, if you're having vaginal dryness, multi-maca is very good for you. Multi-maca, royal jelly. Royal jelly is also another supplement that is very good for you. Or B-Polin. B-Polin is cheaper than royal jelly. It can also help you. And then also your vitalized women. So if you're having vaginal intercourse pain, these are the sets that you need that can help you. Now, when do you talk to your doctor? Don't wait to seek help for pain at the immediate, okay? Most menopausal related pain can be reduced or eliminated completely with your home remedies and medical treatments and also lifestyle changes like I'm telling you, okay? But the type of discomfort you have may determine what type of doctor to see, and then also you might start with your gynecologist. And a good way to prepare for an appointment, if you want to go and see your gynecologist, is by writing down your symptoms. Get your paper and biro, okay? Get your paper, get your biro, write them down so that you will not forget when you start talking with them. Now, let me tell you some of the things you need to write down, okay? For example, are you having headaches? If you're having headaches, write it. And then are the headaches on one side or overall of your head? Are you able to tell if the pain you feel during intercourse, when you're having intercourse and you're having pain and you're discussing with your doctor, is it within the vagina or is it your vulva? You need to find out. Then if it's the vulva, does it include the inner and the outer lips of your vagina? Is it your clitoris? Is it the external opening of your vagina? You need to know all those places so you'll be able to write it down and discuss with your doctor. The more detailed about the pain you feel you are, the better you arm your doctor or your medical practitioner, you know, to be able to analyze the symptoms that to help you very well. Some women get so shy that they don't talk, and then they don't get their doctors to be able to feel them and know what to do. So your doctor will give you like a blood test, first of all, to determine your hormonal level. And then also, they might also test you for hypothyroidism, because sometimes the symptoms of hypothyroidism resemble that of menopause, okay? And then they will now know other tests to write for you. So now let's go to the cocoa of the matter. How is menopause pain treated, okay? What are the natural solutions and remedies for it? Pain, discomfort, and other symptoms of menopause can be treated in different ways. I've mentioned like 6 for us today, okay? All right. Pains reduce. If you have you can go through some pain reducing treatments, like you can take pain relief if it's mild pain, relief, joint if it's for joint pains, maybe like ibuprofen for some days, and if it doesn't work, okay, for those of you who want to go through medicine. But I advise you, like I said, pain drugs and medicines go one way, supplements go another way. Now the difference between the two is this: pain relief medicines and drugs, okay, help to treat the symptoms. Supplements give your body what your body needs to heal itself. So the supplement gives your body what it needs to heal itself, and you're not begin to be healed from inside, and then it brings forth reversal. All right, so that's why I have mentioned some of the things, pains you might have, and what you will need to go through them. You can rewind the video when it's posted and find out your own section and what you need. I won't be able to go through them all over again. So number one, you can take medications, but if you're even taking medications, to check out if they will go immediately, please take your aloe vera gel so that it can reduce the side effects of those medications. I told you what my husband went through when he was having spondylosis, arthritis pain on the shoulder when we were in Germany. That's what made me love Forever Move Active HA, and that's why since that last year I've sold this every day to people, and that's why I'm giving you this 30% discount between now and 8 p.m. today again. All right, so if you're taking medications, take your aloe vera gel so that you'll be able to cushion the side effects of those medications. Then another thing you could do, immediate home relief, is ice packs. They can help reduce your knee and lower back pain. Okay, they can help release your knee and lower back pain. The number 3 thing is supplementation. You can chat me on my WhatsApp number +234 703 515 1642 +234 703 515 1642, so that I'll be able to give you, let me put it again here. Okay, my WhatsApp number, I'm blacking time, so I'm rushing. My WhatsApp number is +234 703 515 1642 +234. Okay, I'm putting it again because I couldn't pin the last one. I don't know why. All right, so dietary supplement, chat me, then I'll be able to tell you what you need. Number 4, cytostrogen or plant-based estrogen, such as soy products, can help you. Like I have what I use, my soy products that I use, okay, to get cytostrogen. I take my Light Ultra. It's a soy plant-based replacement. This is very good for menopausal women. We have it in vanilla and chocolate. Okay, very, very good for you. Then also, I also use fields of green to get cytostrogen, because remember, like I told you, cytostrogen comes from green and very colorful vegetables, some of them. And then you can as well either take your fields of green. This is cheaper because it's in tablet form, and this is in drink form for those who might not, but this has more vegetable than the tablet form. All right, so get your cytostrogen based products and vegetables to alleviate those menopausal symptoms. Remember, like I always tell us, if you don't treat or handle your menopausal symptoms, they can lead to secondary disease, and it's now this secondary disease that will cause all those issues in your body that can lead to chronic illnesses and ailments that will make you age fast. Now, if you're having, another thing you could do, if you're having painful intercourse, like I said, you can diminish your quality of life if left untreated. Okay, so if you want to handle that, aloe jelly, multi-maca, vitalize women. All right, so use vaginal lubricants daily after bath, like I told us, to alleviate the irritation by reducing discomfort and dryness. And then eating foods that are high in omega-3 is another thing. I can't take my omega-3 because of the program I'm running now, but omega-3 is very, very good for you. Active Sea is the best omega-3 fish oil that you will find out there. Then staying hydrated by drinking plenty of water. You can see me today, I finished like 3 of these. This is the 4th one I'm taking today. Okay, plenty of water. You need plenty of water. You need to stay hydrated. That's number 9. 2, like I put a little aloe vera gels to help with the electrolytes, to also prevent dryness. Then number 10, you need to apply topical creams containing estrogen that can help alleviate all these vaginal, symptoms, and also your skin, like I told you, aloe vera gel. And then another thing, during menopause, please, I beg of us women, maintain an active sex life. That it can help to increase blood flow to your vagina and also reduce the thinning of your vaginal wall. Okay, it's very, very good for you to do so. All right, then again, exercise, very, very good. Keeping active can also help reduce your body aches, tone your muscles, making you less susceptible to injury. So if you find that your knees are aching, make walking, dancing, brisk walking, running, okay, your exercise. And then you can also wear knee sleeves. Knee sleeves can help you also. And then because knee sleeves will provide one kind of compression that will help to keep your knees active and comfortable. All right, and also they can also make you less injury prone. And then get good sports shoes. I got like 3 on this my trip. You'll be seeing them on Saturdays, and I even found out that using them as my normal shoe for videos and things like that are very, very good. So get your sports shoe, they will help you. Other ways you can reduce your pain could be deep muscle massage. Like I told you, I don't joke. When I traveled, this was my cream. I rubbed it all over my joints every day. And during this cold season, this should be your cream. Buy your aloe heat lotion, rub it all over your joints, use it as your cream. You can use it as your cream. When you massage it in the morning after having your bath, you will feel very differently. Very, very good. All right. So, and again, another thing you could do, if you're smoking and if you have other bad habits, stop them. They are not good for you at all. They will increase your feeling of fatigue and things like that, and cause so many of those diseases for you. All right. And then if you reduce stress, reduction of stress can also help you. And one of the biggest culprits to weight, to pains, inflammation, arthritis pain, menopausal pain is weight. If you have weight, if you have gained weight, it's going to affect you. So reduce your weight. Now I'm going on a weight challenge, okay? Weight reduction challenge. We're going to go on that challenge from 20th of August for 12 days to the end of August to 1st of September, from 20th. And it's time for you to start getting what you need. You will need your exercise equipment, okay? You can buy from me, you can buy from elsewhere. You will also need your supplements. And this time, if you can't afford Clip 9 to join us in the program, I have a cheaper combination for you. Much cheaper. I'm just doing promo for everyone at this period. So you can get your Clip 9 or you get that combination. I won't show you today. You can chat me on my WhatsApp number if you want to start getting it. We're going to open a chat room for those 12 days. And we will take you through, and we're going to give you a free meal plan. We'll follow you day by day. Breakfast, will tell you the food to eat in your breakfast. We'll tell you the food to eat in your lunch. We'll tell you the food to eat in your dinner. We tell you the snacks you're supposed to eat. So if you can't afford Clip 9, chat me. I'll tell you what else you're going to use. And then we'll start getting it ready. We'll soon open the chat room for you to enter. It's going to be lots of fun. All right. So reduce that weight. Like when I traveled and came back, I weighed myself. I'm not going to tell you what I was weighing. I found out that I have added quite a lot because sedentary lifestyle is not good. So what did I do? I started my DX4 program. Immediately I came back. Okay, and I lost like 6 kg in 3 days. DX4 is on another level. That one is on another level altogether. You need to be really guided to do that. So, okay. It's very important that you do all this. And remember, reduce stress. Pain can feel worse if you are stressed, anxious, or depressed. So with that in mind, finding ways to improve your symptoms of stress, anxiety, or depression can actually help your aches. Sleep. Sleep is also very good. If you sleep well, it will reduce pains and aches for you. It's very important. And also cognitive behavioral therapy. And that is speaking positively to yourself and about yourself. Those can also help you very well. So join our new challenge. In that new challenge, we are going to be handling people who are overweight. We're going to be handling people who are having pains, how to reduce that pain, and we're giving you super discount on all the products during that period. I'm going to quickly check if I have any question I need to answer, and then we call it a day because I don't want this video to be, what did you say I should reply you on? Where did you send me or something? Maybe it's very fine. Okay, you want the book? I say chat me on my WhatsApp number +234. Okay, Stella Maris, chat me on my WhatsApp number +234 703 515 1642 so that I will give you the book. All right. Watching from Monrovia, Edna, how are you? Thank you. Watching from Monrovia, Deborah Ojo, we didn't see US. I hope we see again. Well done. And again, yeah, that's true. We are doing our raffle draw. I'm going to send that to those on WhatsApp. Our raffle draw is this weekend. Deborah, you just reminded me of it. I'm going to send out the post this weekend, okay, so that you get ready to join to see if you're going to win again. For those of you who bought your tickets. All right. Amen, amen, amen to all of us. I'm just looking for questions to take before we call it a day. Ukamaka said, thanks very much, Miles. Welcome situation with peace of mind and joy. Do needful. All right, all right, all right, all right. What are the names of what? Okay, Deborah, what are you asking me? Well, names of what? Just chat me on my WhatsApp number +234 703 515 1642. Okay. You have cracked heels. Okay, if you have cracked heels, chat me on my WhatsApp number. I'll give you a combination that can help you. All right, that can help smoothing and heal it. Look, my skin supple everywhere up to my feet. You can't believe it. Very, very fantastic. All right, Ayodele said, please, ma, talk about the crawling on the back. Okay, like tingling sensation and crawling that you have at your back. All right, if you're having tingling sensation or something as if it's crawling on your back, algae is very, very good for it. And your super green, if you combine these two, they are drinks, they are not swallowable. They are drinks that you drink. Or you can also get your focus. They will also help you with that crawling if you're having any form of crawling at your back. All right, let me see who again. Hey, this thing don't go up. Hi, man. Maho says this stage is frustrating to every woman. You can be enjoyed. I tell you, I'm not frustrated. I'm enjoying myself. The good part of menopause, I'm enjoying it. All right. Okay. All right. Treatment for gas excess. If you're having excess of gas, like I've told you, you need your probiotics. Okay. Pro B, aloe vera gel. Very, very good for it. And then you can also add your Active C. So these three is for acid reflux, excess gas in the system, especially these two, Pro B and aloe vera gel. Very, very good. You can add your fields of green or your Active C. All right. Somebody says the pain is even more than pregnancy. God help you. Amen. God help you. Please chat me on my WhatsApp number. Don't be in pain. Remember that I said if you stay with too much pain, you can have secondary disease coming like high blood pressure, diabetes, ulcers, insomnia, okay, migraine. All these come from staying with pain that is untreated. Don't stay with pain for too long. You have pain on your shoulder, Rosemary F. Young. You have pain on your shoulder. Chat me on my WhatsApp number +234 703 515 1642 or get your Forever Move Active HA, the massage cream, aloe heat lotion at 30% discount just between now and 8 p.m. tomorrow. All right. Constant headache. I've already told you what you can use if you're having constant headache. That was one of the things I treated when I was talking about what to do. I said use your Blossom tea, heat lotion to rub, and then focus. Okay. If you're having constant headache, these three will help you. All right, just chat me on my WhatsApp number so that you can get your prizes. All right. Weight gain. You want to gain weight? Oh, if you're gaining weight, that's why we're doing this program, ma. If you have excess weight, we want to take you through 12 days of lifestyle change that can help you be on a program permanently that can help you reduce weight. The fantastic thing about this program is that we are not removing food from you. You're going to be eating. Okay? I'm doing it with my coach, Coach Ezi Amaka. We are running that program for people to help people. When she stays in America, and we discussed a lot while we were in America because we were on the same time zone. So we got to talk a lot, even though we couldn't see, because she also went for her own holiday outside her zone. So just chat me on my WhatsApp number. Tell me you want that program. I will tell you what you need. Spend money to be well. Spend money to have a better life. And like I said, we're making it very, very affordable for people at this period. It's no more Clean9 that is expensive, that people say is expensive, but it's very effective. Even DX4 is even more expensive. I'm doing it. I came back all the clothes that I'm supposed to buy. I bought myself DX4 so that I can restart my system. And I'm feeling 10 years younger just in 3 days. All right? So DX4 is the super baba. This is the baba. This is the mama. Father, mother. If you want to really read, you can do the two, like Uche. Uche did this, and even did her fit work. In fact, every day Uche is just telling me, Mama, I love myself, I love myself. She says when she goes out and people are not seeing her, she'll say, are you not seeing me? They'll say, we're seeing you, we're wondering what has happened to you. She said everywhere she goes, they'll say, you've lost so much weight, you're looking so younger, you're looking so good. She said, you don't know what this body has seen, what I've done. And you know, she's maintained it for like 3 months now. Okay, because that's the beautiful thing about being in the challenge. It helps you very, very well. All right, okay, I think I've taken all my... Your head even smoke hot. All right, if you're having migraine or maybe it's hot flushes or night sweat, chat me on my WhatsApp number, okay? My WhatsApp number, Queen, is +234. Okay, you're in Nigeria, 0703 515-1642. If you're in Nigeria, 0703-515-1642. Okay. Reducing weight is the challenge we are doing. Adding weight, you can also chat me. I'll tell you what to do to add weight. Okay. Neka says, please, ma, does it mean that one keeps having these symptoms until the actual menopause? In fact, if you don't handle it well, Neka, it continues after, during post-menopausal season. That's why you need a lifestyle change you can enjoy. And that's why I talk about you being on supplements. Supplements are food in capsule. Food that they get the active ingredients naturally from food, and they put it in a way that you can take it and be healthy. To tell you the truth, for 6-7 years now, I have not entered any hospital. And this was me that used to visit the clinic, the hospital every month. Aloe vera gel daily is one of my secrets. Probiotic daily is one of my secrets, okay? I'm being on this supplement. I don't want to show all my supplements again. Some people say it was too much, so let me keep it to myself. All right, so I have an excruciating pain, Funke says, on my left knee with swelling and stiffness. I also have the crawling sensation on my side hip. What you will use, okay? And remember, there is a 30% discount on Aloe Vera Move Active HA just for 24 hours by tomorrow. All right, perimenopause is not an easy journey. It can take a while for the body to balance again. May God strengthen us all of us on this journey. Amen. And also give us the grace to do the right thing. Because if you do the right thing, God has already given us solution. Let's just take hold of that solution and be wise about it. Amen. Favor, okay? Ibudun says, for 3 months now, I'm having trigger finger on my 2 thumbs. It's all part of menopausal symptoms. Chat me on my WhatsApp number and we'll be able to handle it. I need to go now, please. So we'll continue on WhatsApp. Just chat me and then we'll talk, we'll chat, and then we can talk. Thank you all for joining me. Make sure you join me tomorrow. I'm also coming live tomorrow. You can ask your questions, even though I might be treating a different topic tomorrow. I want to talk about your retirement plan tomorrow. What is your retirement plan in terms of your health? What is your retirement plan in terms of your finances? What is your retirement plan in terms of your life, your whole life? How do you want to spend your life? I have an auntie that she made sure she planned her retirement plan in a way that she could still travel every year for her holidays. What is your retirement plan? Come with me tomorrow 8 p.m. so that we can answer that question. And on Saturday, we're going to be looking at how do I handle pains and aches and arthritis during cold season. Thank you for joining me once again. Thank you for the thumbs up. Thank you for the love. All right, God bless you. Queen, the last question says, please, do you have something to use to flatten? Yes, it's part of the things we are doing in this challenge, okay? Chat me on my WhatsApp number. Your tummy can be flattened during this 12 days program we're doing. If I show you my tummy now, flat, 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 with the programs that I'm doing, pre-program that I'm doing. Love you all. Bye. See you tomorrow.